Snohomish, King, and Pierce counties. This includes public and private K through 12 schools. Under this order, schools must close and end classes by the end of this coming Monday. The first possible weekday back will be April 27th. This 6-week closure is not a decision made lightly. This came after many discussions with Secretary Weisman and his team at our State Public Health Authority, Superintendent Rakedahl, superintendents from districts of multiple districts that will be affected, many parents, county executives from each of the counties, the Washington State Education Association, PSE, and others. We have reached a tipping point where the spread of this virus demands that we take action. We're seeing the number of confirmed cases within the Puget Sound area increase significantly just in the last week. And we do not expect this to slow down and will not slow down unless we take action to defeat this virus. Although this virus presents much milder symptoms in children, health professionals have told us that closing schools could create a significant cut in the peak number of ultimate infections. And closing school districts will help slow the transmission of this dangerous virus. School districts within the region are also experiencing unparalleled student absences even today. Many districts are also struggling to staff their operations. And during times of uncertainty and risk, we all need to make tough decisions, and this is one of them. Something of this magnitude cannot be surmounted without all of us pitching in. I've already asked businesses in the Puget Sound to expand options for telework. And with school closures, those options become even more important for parents who have children who will be affected by this order. With that being said, there are critical services our schools provide that will need to continue during this closure. That includes nutrition and child care. I've asked the superintendents from King, Snohomish, and Pierce counties to have a plan for the continuity of these services. Nutrition services for students who rely on school meals, and support for students experiencing homelessness. Based on what we are hearing from OSPI and other partners, we have every reason to believe that we will be successful in this regard of providing services to these children in need. We are in talks right now with philanthropic and service organizations ready to help students impacted by these closures, such as distributing boxed lunches. This effort may also ultimately involve our National Guard. I've also asked we simply cannot afford health professionals and first responders who cannot do their duties. People should understand nothing in this order precludes public, private, or charter schools from using their facilities to provide child care, nutrition, and other social services. If a school in any of these 3 counties is open and providing child care, it is my expectation that staff will take every measure possible to provide social distancing, ensure consistent hand washing, send students home if they're sick, and routinely disinfect commonly touched surfaces. I think now is the time for us to come together, and I encourage local education associations to work with their superintendents to be as flexible as possible within their collective bargaining agreements for the safety and health of students and staff. I want to repeat, these closures are limited to the 3 counties named, but it's very important for all school districts across the state of Washington to have very active, robust, and meaningful plans for contingencies that may include them in future closures. And those could come in the near term. We are aware that other counties may end up becoming part of this effort, and we may be making similar decisions.
Thank you, Gov.Inslee. I'm Chris Rakedale, State Superintendent of Public Instruction. I want to say first off, our kids have been very safe in our schools through the duration of this process and the duration of this viral outbreak. Early indications from our health officials made clear to us that that was the safest place for our kids, and it remains a very safe place for our kids. As the governor indicated, the infection rate for young people is very low. Their incidence of being symptomatic is very low. But things change. And as we understand more how this unfolds, it is important that we keep the health not just of our students, but their parents, their grandparents, and the overall communities in our minds. And one of the protective ways we can do that is to take the bold actions that the governor has just indicated to ensure that we have every focus in the world at the social distancing strategies that ultimately protect our entire community. I say to young people when they ask me about this, you may not ever be symptomatic, but if you are a carrier, you may be putting your grandparent at risk, and there's a time to take more significant action. It's a very different world than it was just a week ago or a couple days ago. We have 15 districts in the region that have announced closures. They've joined districts who had already had short-term closures. These are, this closure, as the governor has indicated, is up to 6 weeks. It involves 43 school districts in those 3 counties. It is roughly 600,000 students. It is more than half of our student population in the state of Washington. It begins, as the governor indicated, no later than the end of the I mean, 82% of students have been absent. It's an 82% increase from 6.2% to 11.2% in a very short period of time. Some districts, their absences exceeded over 20%. Schools in Snohomish County had a 56% increase in absences in that time, and Pierce County, a 13% increase. And let me just say right now, a thank you to the governor for being really bold here. Pierce County does not appear to have as much infection right now. That's exactly why you make this bold decision in an area where we think it is very plausible the numbers will grow, and that's why he's made clear that he will use additional criteria should the need for other counties to be included. But right now, these are the most impacted areas and the places we can get ahead of this. Staff attendance is down. We have a disproportionate number of our bus drivers and our substitute teachers who are over the age of 60. And you've seen indications from local public health officers to take special care to protect them, as those numbers of adults have found themselves unable to come to work or made the smart choice not to come to work. For some of our districts, it's been nearly impossible to have a continuity of services. And when you get to that place, you then have a very inequitable public education system. Guidance released by our public health officials, again, focused on over age 60, and we've seen the impact from that. Statewide, more than 16% of our certificated staff are over the age of 60. So not just bus drivers and substitute teachers, but 1 in every 6 teachers is over the age. That may happen at a distance. That is not a mandate of the current closure, but that's part of the reason for our thinking right now is we need to be prepared for not just the moment today, but this fall. Contact tracing has become an issue, as you know. We have amazing public health experts and folks at our universities and the CDC who could initially map the contacts that individuals are having with people when they were diagnosed with COVID-19 or they were tested and confirmed. That becomes very difficult with the kind of numbers we're now seeing in King and Snohomish and increasingly Pierce County. These are some of the reasons of what's changed, and I want to be clear about why the guidance now is so different. We want to encourage school districts in this affected region to think about next week as a spring break. Many of them will be on spring break during the duration of this closure. It gives us a really important opportunity to minimize the learning loss for students. But we want all districts to think about next week as a spring break. And the public should not expect that we have these services fully stood up immediately. Districts need time. They need time to think about how to prepare services and supports for those first-line workers, those emergency response workers and healthcare workers. They need time to make sure their food distribution systems are in order. We are prepared. We have been building for this moment very rapidly in the previous few days, but there's going to need to be more work done. We want to continue to honor the fact that we finding meaningful work for them when they can. This will take an enormous economic impact to our state, to our region, and ultimately to the nation. The school system is $1 billion a month compensation system for professionals throughout the state, and we intend to keep that compensation flowing so that we are not a contributor to the economic impact, not in the short term. Our hourly workers are a challenge. I want to be very clear about that. It is a harder contemplation for those who are paid hourly in our school systems. We're working with Employment Security Department and with our districts to try to figure out strategies, obviously, to keep them fully engaged in their work and where they cannot keep compensation flowing. But that is a particular group we don't have a clean answer for right now, but we are working with them, their representatives, and our employment security folks. Finally, I want to say we're going to keep some services going, as the governor said. We already have a system in place and waivers from the federal government for meals. Every single family who needs a meal can come to our schools as we build this out over the next week, including those who were not previously eligible for free and reduced price. We have the flexibility now to provide a meal to families. So if you are a working family and you find yourself in a difficult situation, perhaps your employers had to let you go, there is not going to be a long line or a bunch of paperwork to get nutritious breakfast and lunch for your children. It's going to be available. We can continue the payroll, as I indicated. Everyone is prepared for. There are questions that folks have. There are nervous and worried families, and we are working really hard in partnership to get answers to those questions, to keep services available, and to maximize the supports for families. But this is also a moment where the health science tells us we have to create social distancing in unprecedented ways. You've seen the NFL, the NBA, the NHL, Major League Baseball, the NCAA tournament. You've seen incredible announcements in the last 6 to 8 hours. We are a visible observation for the rest of the country, and that's why we're taking significant steps to close schools on such a broad geographic area impacting so many of our students. We are going to put the health and safety of our families and our vulnerable seniors first and foremost. That's what this action is about. We have a local superintendent here, Creston Barr, from Eatonville School District. She heads up our School Superintendents Association, who I know could be available for questions. And we have Senator Lisa Wellman here as well. Thank you, Senator, who oversees the Senate Education Committee and has been following this exceedingly closely at this point in time. I will step back, Governor, and facilitate questions.
Thank you. Happy to take questions.
Governor, I need to the situation and that other districts.
Yes. can solve the problem. You need to have a broad-based assault on every front. And we believe this is the right place to enter the front of school closures, and that's why I have advised districts to get ready for this in other places immediately, because other closures may be coming.
Governor, what do you think?
We're going to go this way here. Yeah.
Are these days that are going to need to be made up going into the summer based on the emergencies?
So I'm going to let Chris talk about the chronology of that. You want to talk about that?
So we've given guidance to our schools already that this is obviously a pretty unprecedented moment. My office has the ability to waive both instructional hours and school days. We've already indicated to them that they are likely, assuming we make a return to school under the timeline that we have indicated here, that they will be making up some of these days into middle or later June. They also need to prepare, however, for the next school year, and there's some really essential work that goes on in that time. So at this time, we expect some of these days to be made up. We do not expect that, given the length of this closure, that it will be anywhere close to mathematically possible to make them all up. We will lose some instructional time this year in these 3 counties at a minimum. So seniors, we have credit requirements in the state, a certain and they will do the work.
Governor, what do you think of President Trump?
L6, could you just defer just for a minute, because I want to add something. I wasn't intending to talk about colleges today, but since Chris mentioned it, our advice to all school administrators, including college administrators, who have not already closed their on-campus, non-remote learning, they need to get ready for a potential closure as well. Now, we have not had adequate discussions with college advisors to make specific decisions about this, but I would advise college leadership to do the planning necessary for potential closures as well. Essex?
Governor, what do you think of President Trump considering a possible travel ban to Washington State?
Well, I at the moment, on occasion, this president says some things that don't come to pass and never were going to come to pass, and I hope that that's one of them. We've had no discussions with the White House on this. I've talked to the Vice President 4 or 5 times now, and that has not come up in any discussion. So at the moment, it sounds like a random comment by the President rather than a thoughtful consideration. And I will be talking to the Vice President the next day or so and about several things. I don't believe that's cautious about exposing themselves to confined environments with many people. And that's the same advice I'd give to anyone for any confined situation. Beyond that, the federal government largely has control of those decisions on the aviation industry. And I just have to tell you, I'll just tell you what I've shared with my family. This is a moment where all of us can be leaders to ask whether we really need to be in close contact in any conditions that are really not essential. Now, that's really hard to think about, but it is true. And almost for everyone who doesn't have to be in close contact for the next several weeks at least, I'm advising them to think about that seriously.
Secretary, speaking of private schools, how did you provide your advice to them, or do they have a conference call? Secondly, I don't know if you have the powers of the ministry of homeschooling. There may be parents who now want, because of this long break, to become homeschoolers. Is there a process where they could become it?
I don't know. Chris, do you know about homeschooling?
Yeah, so I had a video conference this morning with private schools and helped them understand that it was my understanding that this proclamation would include them. They understand that. We are often in very parallel situations in terms of the safety and health of our students and have a good coordination in that. They appreciate very much the guidance and the consistency around this. Homeschool is a choice that a lot of families make in
transmission rates and the community spread appears to be at a level to justify the downsides of school closure. We'll make that decision for other counties, Eastern Washington and otherwise. Now, that is not a numerical criteria. There isn't any percentage I can give to you because we're really not, it wouldn't be meaningful at this moment to try to develop something for each county like that. So this is going to be a judgment call like many things are in public life, but I am very confident that it is the right decision, the safe decision, the prudent decision, not just for our children, but for their parents and their grandparents, to make school closure decisions when we believe it's going to try to slow down a rampant epidemic. And we are facing a situation where we have to look forward. So we can't be thinking about March 12th. We have to be thinking about May 12th. And on May 12th, we could have, 30, 40, 50,000 people who are infected with this virus in the state of Washington. And I think as elected officials, we've all got an obligation to look over the horizon. This is a decision that looks over the horizon of what our state is going to be faced with if we do not act. So we will act in counties where it makes sense. And I do want to reiterate, that could be in the very short term. That's why I'm really encouraging school districts to start thinking about this hour about what you're going to do if we have to do closures in your county.
Governor Inslee?
I think he had one, yeah. Oh, wait, he had one too, didn't he? Yeah. Chris will probably have a better number. Do you know the number on free and reduced lunch percentage?
Yeah, it exceeds 40%, but we can get you a very specific number.
So moving forward, when can they start getting those meals? I know that the districts are working on that, but any idea of a timeline?
So each district is going to respond as quickly as they can to that. Our guidance will be very swift. By this weekend, they're going to have the initial set of guidance on things like apportionment and things like nutrition and meals. We have districts who are very sophisticated about that right now. They do summer programs. We have districts who do not have summer feeding programs. So there could be a little bit of differences from district to the other. We're going to ensure that they know the money is there, the meals are there, it's not a food supply issue at all. It is a matter of making very clear to them that this will be available through the entire three-county area, and again, expanded, not just those who are currently eligible. This will be eligible for any family who finds themselves suddenly in the need for it.
I want to add something to that. This is something of acute interest to us, obviously, and I've been really pleased what I've heard from the superintendents of their ability to get this job done, in part because there's a variety of ways to do it. The North Shore District, I've been advised to actually have 16 remote pickup points where you can come pick up your nutrition at a remote place, maybe not even have to get out of the car. So there's a lot of creative ways to do it. I think we're going to be able to accomplish this.
Following up on the question about remote learning, it's easy to Monday morning quarterback this kind of stuff.
Yeah. Several of the area of our institutions are developing the remote test so you can take the sample. There's two parts of the test, as you know. Take the sample involves a swab in the nose and a little bit on the cheek, and institutions here are developing ways to do that very effectively. So it's just a drive-by sample testing, testing facility. They then ship that sample to a testing lab, and then you get the result. So, for instance, the University of Washington, they have a standalone test sampling where you can go in and have the swab and take the sample. So that's being done. I'm sorry?
That's a small scale, right?
No, it is, and it is building, is what I'm telling you. Other places, there's an outfit, and I'm told in Everett that's looking for a standalone facility so that it'll be easier to do that. Physicians can do this. Virtually every physician has in their office a swab to be able to take the sample in a plastic bag. That's all that's needed. Well, I've not been advised that that's necessary for that test, so we'll get back to you if that is the case. No, testing is taking place. I just checked, and I'm going to hand to you a little later on the capability to turn around the tests at the laboratory. Right now, there's basically no backup at the state lab. We're advised that Quest has a turnaround time of, they're going to get it down fairly quickly, and at the University of Washington, it's within that this virus is going to spread in the state of Washington under any circumstance. It is our job to slow down the spread of that epidemic. And we do believe we are capable of doing it if we use these social distancing techniques that we know that work. But there's another way not to sugarcoat this. This school closure is going to be tough on families. They're going to be there tonight trying to figure out childcare. There's going to be questions about when we actually can fully get back. And so this is going to be really hard on families, and we shouldn't diminish that. So I think it's a moment that I hope everybody can pull together. I hope that if you want to have a shining moment where you can help your community, you're willing to talk to your neighbor and see if they can need a hand with childcare or some other, or transportation. This is a moment where we can all be leaders. So far, I'm seeing a lot of leaders in Washington State, and we want to continue that momentum. Thank you.
John, can you answer the testing capacity question and the PPE question? We've got to go that.
Yeah, thanks for that. So recently, the CDC revised its guidance around what is needed for caring for folks who might have COVID. And I think you're correct that the N95 respirator was one of those things that was recommended as you were taking samples, which some of the clinics don't have. They don't have people who are fit tested to do that. But the World Health Organization guidelines and everybody else really uses the surgical mask, the standard, face mask. And with that sort of now being the CDC guidance, that should hopefully free that up. And right now, there are folks who are looking at sort of developing these quote unquote sort of drive-through testing spots, and that's being planned right now. And so we're looking at the experience of some of the healthcare providers who have already done this to see what their lessons learned have been about that.
Mr. Weasley, can you address the positive test at the Tumwater office and the Department of Health and whether you had any contact with that person?
Right. So like many employers who are now having employees who test positive for COVID-19, we at the State Department of Health had an employee test positive for COVID-19 over the weekend. The employee was last at work on Friday and had no symptoms at the time. We engaged the Thurston County Public Health and Human Services, who is our local health department. The individual was reported to that department, and we engaged them. A contact investigation is being done, and like any other situation, the individual was asked for their close contacts, and those close contacts are now not at work, and I was not a close contact.
When we look at live care, for example, when we look at live care content, it's been almost 2 weeks and the staff members there still don't know how to test it. Why is it taking so long to get testing to the epicenter of this outbreak?
can contact them to see who their close contacts might be. So it's really that case finding and contact tracing, as the superintendent nicely said. I should make you a public health official in his remarks. So it's about that, and it's also about trying to identify sort of where it might be in our communities. So both of those are the goals with testing, and I would say that especially for those folks who might be at high risk, one of the reasons we are interested in having them test is we still have flu around. And so they can actually go to their provider and get a flu test or other rapid tests for other respiratory diseases. And if that's what they have, there are actually some medications for that they might be able to take. So that's one of the reasons we're interested in the sort of folks who have underlying chronic health conditions, is really so that if they've got other issues, they can be treated for that.
If a physician is calling a patient and they have the symptoms, do you want those physicians saying, come in and get tested, or stay home and stay away from people and get over this, and unless you need an emergency room, urgent care gets worse, I don't need to see.
Right, that's the conversation that physicians are having with their patients right now, in understanding why they would want the test. And as you point out, one of the risks of having folks come as much testing, the product to do the testing as we can. The commercial vendors are very interested also in going to the places where there are cases, and certainly across the country you're seeing more and more states having that. So those are the conversations the governor has had. I've been with him, with companies, encouraging them to prioritize Washington State. And I think it's important to note that some of these companies don't actually do the testing here. They actually send their tests to a lab, a centralized lab elsewhere in the United States. And so that is one of the reasons that the turnaround time for some tests may take a bit longer than some people would like, is that those have to be shipped, tested, and then the good news is the results come back electronically.
So if somebody goes to the doctor's office, they say, hey, I need to get tested, the doctor agrees. What then happens? Does the doctor call the state health lab and say, hey, I have somebody here that I think needs a test?
It can happen in a variety of ways. Now that the commercial labs are coming on board, clinics usually have a relationship with one of the testing companies for a bunch of other tests they do, whether that's, and so there are a number of large companies. So they're most likely using their normal vendor for their lab tests. They can also order it and send it to the University of Washington or to the state lab. So they do have options.
And then just one last question. So then what
in younger folks are usually much smaller in number. Their symptoms tend to be very mild, maybe so that they don't even realize that they might have COVID. In the current tests that we have done, 2% of the test results that are positive have been in those under the age of 19. So it's a really small number of folks. The vast majority of those who test positive are in the 60 and over category, and that's typical of what we see, I think 50-some%. It's also who we're encouraging to get tested.
So that would be 10 or 15 out of the 400 that are on the department.
Yeah, so there's like 366, I think, currently on the website. So 2%, actually it's, 2% are under the age of 19.
Let's just give us a clear. Last one for John, then who's got to go? Maybe.
I'm sorry.
The governor said there could be 1,000 cases and that could be 64,000 in 6 weeks. Do you have any clear sense of what the actual number is? And secondly, you have this national stockpile of equipment. Are you getting purchase requests for that from county public health officers, from frontline providers? Is there a need for that equipment?
Yeah.
It would suggest that this is in a lot of places rapidly spreading.
Right. So on the first question, we are working with modelers at our research institutions here in the state. They're doing great work working with us. They are getting samples. Our goal is to see to it that that line doesn't keep going up, that it's a slower acceleration and flattens, and that's exactly what we are working on right now. It's why we need everybody to heed our advice, to take this very seriously. If you have not taken this seriously before, now is the time. Now is the time that if you are not washing your hands well, that you do that. Cover your coughs with a tissue. When you throw that in the garbage can right away, don't leave it laying around. Those are the things that are important. In terms of the personal protective equipment, the personal protective equipment supply is extremely tight. Our healthcare providers are having a very difficult time ordering those supplies. We know that. And the governor has had conversations with the vice president, as I have had with federal officials, about the need for them to increase the production of that personal protective equipment. We have to keep our healthcare workers safe in order for us to address this outbreak. And and to finish with that, the state, when folks can't get supply, then they go through their local emergency management, and if they can't get PPE, then it comes to the state, and we tap into and make requests of the federal government to the Strategic National Stockpile. We've done that now on, I think, maybe 4 occasions and have been receiving our supplies. Thank you.
So that's true. The stockpile is working. We're getting it. It's getting to people. The governor talked to the vice president yesterday about it again. So it's not been a problem.
Right.
You need to go.
You got it okay?